Good. I tried to be as short as possible because probably my presentation is most boring of the day. But I would like to give you a quick overview of what actually we do at the European Commission level on this subject. And first of all, I would like to remind you that the healthcare systems are the responsibility of member states. So there is very little which is actually in the hands of the European level when it comes to cross-border healthcare only. Then it is something that we can address. And I have in this slide given you an overview of documents that are adopted at the EU level, in which each of them somehow the healthcare is addressed in more deeper way or in more superficial way. For example, in the Digital Agenda for Europe, Key Action 13 says that its objective is to give an access to patients to their electronic health records, or not even talking about patients, citizens. Or then it is more detailed in Article 14 of the Cross-Border Healthcare Directive, where it says about an establishing of the electronic health record, the patient minimum data set for having an access across the borders, or establishing the system for e-prescription. Or when we talk about the eHealth Task Force was established by the Commission, consisting of experts from the field, from different areas of expertise, from doctors, lawyers, politicians, IT industry, who expressed their views on the development of healthcare in Europe until 2020, focused mostly on data and underlined some very important principles such as an ownership of data, about the importance of having an access to data, sharing data, and all these aspects, but you can look to these documents also in our website. eHealth Action Plan actually is the summary of all activities happening at the EU level, but it also underlines the importance of member states in this work. So it is not somebody's document, it is not a document for our unit in DG Communication Networks, Content and Technology, where I come from, but it is also it describes the work which is done in the DG Research and Innovation, that is in DG Health and Food Safety, DG Employment, for example, where the health at the workplace is discussed and addressed. So this is an overview of all activities that happens, and the next slide I will come to that in more details. And Green Paper on mobile health also contributes to this work, because as the previous speaker mentioned about all this information that people themselves generate, and that could be linked to the electronic health records. And also the most recent document, Communication on the Digital Single Market, mentioned the topics of telemedicine and mobile health, and in particular in terms of standards, working towards a standard so that information could be shared and used and become more useful for the improving health outcomes. eHealth Action Plan 2012-2020 can be largely described in four items that we are working on. First of all, the issues on interoperability. Technical, semantic, because in particular when we talk about the cross-border healthcare, then the semantic issues become even more relevant than it is at the national level. Legal questions about the liability, the questions of the data security and access to data, and the organizational questions as well, because in principle sometimes we can address all first three things, but if the organizational support is not there, then we don't get anywhere. Then the research and innovation is a very important part, because we provide quite a lot of funding through Horizon 2020 for developing the projects on research and well as innovation. And on the 13th of October, just a new work program for 2016 and 17 was adopted. Third part, equally important as all others, about the deployment uptake. Awareness is still rather low compared to what we imagine here in this room, that we all know the subject and are supportive. But nevertheless, there is lack of demand from both sides. The doctors don't ask for it, but also the citizens don't know. We had in the European Health Forum in Gastein a small survey in the audience asking, for example, how many people that whether you have had a contact with your healthcare professional online. Doesn't matter in which format, but in principle, have you had this, used this opportunity? And one option of the answer was, these services are not available in my region or in my country. And that was actually the most often used answer. 55% of the people in the audience, of around 70 people, said that these services are not available. While just 2 speakers before had presented an overview of what is happening on online services in 18 member states. So the question is that just people are not aware. Also the question of funding, who pays for these things? I don't think that we can expect much of scientific evidence out of implementing electronic health records, at least at this stage. Because quite likely, the fact that you avoided, as a medical doctor, you avoided the prescription of the medication because your electronic health record told you that this is contraindication exists in the past, or that you chose a method of surgery because of the information gained through this electronic shared data, will be somewhere recorded as a benefit of electronic health record. I believe that electronic health record is another way of doing things, what you would do anyway. Because health record is kept, but it's now just an electronic format which can bring added value. So, but I believe that one day we can maybe make some comparison also, how do we get the control group? So, but that's another discussion. So we tried to create an evidence, but not only on electronic health report, but in principle on e-health subjects. Then I would also like to highlight here the European Innovation Partnership on Active and Healthy Aging, which addresses the integrated care issue in particular and telemedicine. But that has already been discussed here yesterday as well. And then the point of digital health literacy. And I would really underline all 3 words of it: digital, health, and literacy, because digital skills is also one of the key actions of the digital agenda of Europe, and also underlined in the digital single market strategy, because it is important prerequisite for developing this world and bringing it to citizens, as well as sometimes to overcome the barriers or I would say that opposition of healthcare professionals, because the digital skills are not advanced enough. Either they are afraid of spending too much time on it, or they just don't know how to use the tools. And last point on international cooperation with World Health Organization, with OECD, we have also signed a memorandum of understanding in cooperation with the United States on this matter. So there are different activities on this area. Few projects that I would like to just highlight. I will not go into the details. The EPSOS, European Open Smart Services for European Patients. That was the first step towards the cross-border exchange of information. And following the EPSOS, which clearly indicated that there is a need for more alignment of member states in order to make it happen, the next project, EXPAND, was launched and is now going to end the end of this year. And this project further takes what EPSOS delivered and is creating the tools to start using the funding from the Connecting Europe facility. Connecting Europe facility is exactly foreseen for establishing the connection across the borders. It is not only for data exchange, it's also for transport, for example. But e-health is one of these fields where the funding will be allocated, and member states are invited to ask for, submit their request for financing from the Connecting Europe facility for further developing this health data exchange. And of course, this is in very close cooperation with the eHealth network, which consists of the member states authorities who come together to give their endorsement to the progress. I am very sorry that in these discussions where we have mentioned patients so many times, nobody from the patient organizations is present. But nevertheless, I would like to show you 2 projects that we have funded. Also, it is the project Sustains, which was already mentioned, that looked about how the access to e-health tools would impact patient empowerment. And it was the citizens in general. And the other project called Palante, which looked at an impact of e-health tools on patients with chronic diseases. And I would only say 2 things that I would like to highlight. First, of the Sustains project, it was clearly demonstrated that patients want to have an access to information. And the fact whether they understand or not, they don't care. They just want to have an access because they said, I don't mind if this information that I get is scary or it makes me cry. I will cry with my family and with my friends. And when I go to see a doctor, I am prepared. I am prepared, I can ask questions, I can get it forward, not that then the doctor tells me something that I will be shocked, and I will leave the office without asking any reasonable question about my condition. And the second thing about the Palanta project, that demonstrated that people go to use these services more if they have a trust towards the healthcare services. It was not opposite, that using these services will create a trust, but that if you have enough trust, you start using the services. That was also an interesting result of this project that was just finalized this summer, and which final results are or will soon be available on their websites. As I mentioned in the beginning, the work program 2016-17 was adopted on the 13th of October, and there are a few topics that I would like to call your attention to. We have one project which is about the use of big data for public health policies. And public health, here I mean the community health. I don't mean the healthcare systems. Public health is everything that is addressed towards the physical activity, eating habits, smoking, alcohol consumption, typical WHO definition of public health. So how big data could be used for that purpose? We don't actually define what do we mean by big data there, because it can be a wide variety of information that is already existing, but we don't know how to use. I will not repeat what was said before, my previous speakers, about what is the question that you would like to ask, what is the purpose you would like to ask this question for. That all is expected from these proposals. And the second point that I would like to make, this public procurement for innovation, that is this PPI standing for. It is meant to support the public authorities in their innovative approaches, to basically share the risk of implementing an innovative tool in the system that would otherwise maybe not be taken this step, but with the help of the community funding, maybe the authorities will be much more eager to take a step towards that, so that we would get to more closer to this exchange of health records. And the final one about the support for the ICT SMEs, that is also a funding opportunity, because it's the first time in Horizon 2020 when the support for SMEs only is foreseen. And there is a website where you can get the information about all these projects and about our documents as well. Thank you.